How ready is Asia for COVID's big chance to escape China once again? The world's most populous nation was cut off from the rest of the world for 3 years. Now it's dropped lockdowns, other quarantine rules and mass testing. The virus is spreading, but the real numbers are hidden in even looser statistics. Australia is taking precautions, announcing testing for all travellers from China. Here's Australia's Health Minister.
Well, a key factor in my decision over the last couple of days was the view that the World Health Organisation put, I think, on Saturday, that said that there was an absence of comprehensive information about the situation in China. I think people are particularly concerned about the lack of genomic sequencing being shared with the rest of the world, and that is the way in which we identify at a very early stage the possibility of new variants of COVID emerging. This is something that's pretty much shared in real time by other countries, but isn't being shared right now by China.
On information sharing and the real risk of COVID, especially for Hong Kongers, I'll talk to a health expert in a moment. First, this report from DW's Phoebe Kong on the pandemic's continuing threat to the elderly.
Mrs. Wu is getting ready to deliver some food to her husband at a home for the elderly. She used to visit him every day until 3 years ago. The pandemic put a stop to that.
I brought him some biscuits today. Unvaccinated families are only allowed to leave the food at the entrance and let the staff pass it on. I can only talk to him over the phone.
It's only one of a variety of places in Hong Kong that still ban unvaccinated people. Until last week, Mrs. Wu couldn't go to restaurants or public markets. Grocery shopping was also limited. Like hundreds of thousands of senior citizens in the city, Mrs. Wu stands firm against vaccination. Despite years-long inconveniences and a deadly outbreak last year, while she's a bit worried about catching COVID, she's far more concerned by potential side effects of the jab.
What if my body cannot handle the vaccine? I'm scared of the side effects. It can't be undone. Not to mention, it doesn't guarantee 100% protection. The severity of the disease depends on how strong people are too.
This hesitancy is also attributed to the novelty of COVID vaccines and mistrust of the authorities. 15% of Hong Kongers 60 years or older remain unvaccinated, and those who have gotten jabbed generally have had a domestically developed COVID shot. The German-made mRNA vaccine is available in Hong Kong, but it's not a popular option for the elderly here. Many of them prefer the Chinese vaccine because they say it has milder side effects, even if it's less effective in protecting against severe illness. As Hong Kong has lifted most of its COVID restrictions and prepares to fully open its border with mainland China, concern over an influx of infections is growing. That's something Mrs. Wu has discussed with her relatives on the mainland as well.
It's said that COVID can be treated as a cold now.
For almost 3 years, she has spent most of her time at home. Mrs. Wu barely left her neighborhood and cut off nearly all her social contacts to avoid infection.
I'm not very anxious about the opening up. I'm confident in my own immunity as I seldom get sick. It's my freedom to choose not to get the jab. I don't blame anyone if I contract the virus.
However, now may not be the best moment for her to lower her guard. Hong Kong is bracing itself for another surge of the coronavirus.
And let's talk to Dale Fisher, chair of the WHO's Global Outbreak Alert and Response Network. He joins us from Singapore. With Hong Kong reopening its borders to mainland China, how bad could the COVID surge be?
Well, firstly, with all countries opening up their borders to China, I think every country has to consider the potential threat both to its population and its health system. They're the two areas that are of concern. So if a population is very well vaccinated, particularly the seniors, and well boosted, then really they should not be under particular threat from severe disease. If the health system is strong and a lot of Chinese travellers start accessing it, then of course that could put a threat on the health system. But really it depends on how many infected travellers actually enter the country that could cause that risk, and also the resilience of the country and the people itself.
Well, Hong Kong is a travel hub, and a lot of its seniors are not vaccinated.
Yeah, and this could cause a risk. We've seen this problem of seniors declining vaccination in Singapore as well. Singapore, Hong Kong and China, and they're obviously at a greater risk of severe disease. But of course, there's been more disease circulating in Hong Kong for a longer period, so there'll be a higher level of natural immunity there.
Some seniors in Hong Kong say that COVID can now be treated as a cold now. That's at least the information they're getting. How true or false is that when you're in that elderly age bracket?
Well, it can't exactly be treated as a cold. It's obviously more infectious, so it can affect more people in a shorter period of time, and it still has potential to cause severe pneumonia. So yes, you could argue that if you have COVID, you could stay home if you've got mild symptoms and perhaps isolate yourself, or wear a mask if you do have to go out and you've got symptoms. But still, if you get more severe complications such as chest pain or shortness of breath, then really that would be a reason to go to hospital, and that sort of outcome is unlikely with a cold.
So should people be more concerned about side effects of the vaccine or COVID-19 itself?
It sounds like conversations that we had a year ago with the rest of the world, doesn't it? And obviously the answer's exactly the same, that your risk of severe disease is about 1/10 if you're vaccinated compared to unvaccinated. So definitely, of course, there are potential side effects, but they're well outweighed by the risk of disease in the unvaccinated, particularly the elderly and immune compromised.
And Dale, what's your take? Are the mRNA vaccines better or the Chinese ones?
Well, again, the best vaccine is the one you can get, but if you had the choice, I think most people would take the mRNA vaccines because they have been shown to have improved efficacy against severe disease. But obviously that wasn't really the choice. So we could see higher levels of severe disease because of taking a relatively less effective vaccine.
In your work, you target alertness and readiness for this virus and the surges in this virus. Can you explain why it's been so hard to get the elderly vaccinated in Hong Kong and China, the age bracket at highest risk?
Yeah, it was an interesting phenomenon. It actually took us by surprise in Singapore a little bit. And when we went round those people, the reasons there were 3 or 4 reasons. One was that they were just much more fatalistic, and whatever happens, it happens, and I'm just going to let nature take its course. Of course, that's what happens until you get sick, then you rush to hospital. But many people were worried that it could affect other comorbidities, upset their blood pressure or their heart disease, which of course are the people that would benefit more from the vaccine. So they're not good reasons, but it was a very culturally linked foundation, if you like, and we saw it in Singapore, then Hong Kong, then China, in the sort of elderly Chinese, quite different to the rest of the world.
Well, wouldn't it help all of us if China shared more information on the real COVID picture?
Well, I think it'd be helpful. I think most people across the world are saying that the information being shared is fairly inadequate, both in terms of case numbers or the state of the hospitals getting overwhelmed, the deaths. So certainly that would help us consider the potential impact on other countries, and also whether we could provide anything in terms of help at a global level. I might add, though, of course, once you are overwhelmed with so many cases, everything falls down, and it's possible they could be having trouble with data management as well as all the clinical cases.
Dale Fisher, thank you very much for talking to us today on DW News Asia.